Good afternoon, everyone, and welcome to another edition of Cancer with Dr. Denise Ejo, CEO of Comwood Cancer Foundation, in partnership with Plus TV Africa. I want to welcome you all to another exciting conversation on appreciating how radiotherapy influences cancer treatment outcomes. I hope we're going to have a lovely conversation, and great to see you all again this week. So let's start the day and let's start our month. First and foremost, this month is Cancer Survivors Month. So for us to be able to make sure you get the message, I'm going to say follow us on all our social media platforms as we share various activities from various organizations. So it's not just about us across Nigeria. Just check out Comwood Cancer Foundation and we'll tell you what's going on. So good afternoon, everyone. And today we're going to be having a lovely, lovely conversation with two very special guests of mine. Mrs. Anima Shaun. Hello, miss. Hello, ma'am.
Good afternoon.
Good afternoon. We can hear you and I can see you nice and clear. You're looking very bright. And Mrs. Joy Day, but I'm going to call her Joy throughout the program. Hello, Joy.
Hello, Ma. Thank you for having me, Ma.
Thank you for agreeing to do this because, you know, most cancer patients do not want to talk about cancer. Everybody's like, it's a ooh. So let's go. 4th of June is the National Cancer Survivors Day in 2023, and it's an international event to raise awareness of cancer sufferers and survivors. The event is held on the Sunday, the 4th of June 2023 this year, but normally it's always the first Sunday in every year in June. So I want to welcome you to a nice conversation we're going to be having. And let me give you some facts about it. According to the National Cancer Institute, an individual is considered a cancer survivor from the time of diagnosis, the balance of his life or hers, of her life. Every survivorship experience is unique, as they may face challenges during and after treatment. With survivorship, research adverse effects will be controlled, treated, and prevented. So today we're going to be having a very, very interesting conversation with two very, very important people to me. One of them is a survivor like myself. And so you see what? I like to celebrate us. And then I've got a very special lady in this house who has now told me my nickname I gave her is now trending. So that's very nice. Auntie Moji, good afternoon. Oh. So who are my guests? Let me introduce them to you. So first one is Mrs. Moji Anima Shaun, who is a radiation therapist and hospital administrator with over 40 years of experience working in this cancer space. This includes treating patients, teaching HRT students, and mentoring. He is the past vice chairman of the Radiation of Radiographers in Nigeria, and a trustee of Association Radiation Therapists of Nigeria. Muji is also a board member of the Radiation Registration Board of Nigeria. Wow, thank you, Auntie Muji, for joining us this afternoon. And I've also got my healer like myself, a cancer survivor, who is Mrs. Joy Ibude, who had cancer of the salivary glands. That's a very rare cancer, I think, but I'll find out as we go along. Joy started her journey in 2008 when she discovered a painful tumor under the left side of her chin. After 2 consecutive years of surgery, she was diagnosed with cancer of the left salivary glands. She went through 30 days of chemotherapy and 6 cycles of chemotherapy. 30 days of radiotherapy and 6 cycles of chemotherapy. And we thank God today she's also got a second chance. As I would always say, we always have chances for every day we have. So we got questions going now, aren't we? So how are we going to start these questions? Let's look at the topic very carefully. Appreciating how radiotherapy influences cancer treatment outcomes. So firstly, let me first take this opportunity to thank Plus TV Africa, who partner with us and who are going to be partnering with us throughout the month to celebrate cancer survivors across Nigeria. Friends, families, and the support, love, the times you laugh with us, the times you cry with us, and to those who have lost already on the journey, may everyone's soul rest in peace. Question 1. Nice to meet you both. Joy, can you share us quickly your cancer journey?
Yes, my journey started 2008, but I thank God after 2 several years of consecutive surgeries. I was diagnosed of cancer of the salivary glands. And immediately that result came, I was asked to go for radiotherapy because the tumor is the type that grows very fast. They called it grade A adenoid carcinoma. So the doctor hurried us to quickly go for radiation to shrink the tumor and to kill the cancer cell. So which we rally around to make money. Treatment of cancer is very expensive, but I thank God for his help at that particular time. So we were able to raise the money. It was not easy, almost 200,000 as at that time. That was 2000, early 2011. So I started the radiotherapy. The radiotherapy is always given to us every blessed day. It's a kind of machine treatment with a kind of rails that directed to that particular site. So I went through it for 30 good days. And each day is just for a few minutes. As at that time, machines in Nigeria, let me put it that way, they are down, radiotherapy machines. So the only one that was working was at Eco Hospital, Ikeja. So I have to leave my house very early in the morning, as early as 3 a.m. in order to beat the crowd. So I went through that journey for 30 days. It wasn't easy, but I thank God that I was able to skate through it. And there's a side effect that come with it. But I thank God that at least I'm here to share my story today. So I don't know if I should go on, ma.
I want to thank you because I've never really heard of I don't know that word, so please just understand I might be a doctor, I'm an educationist, and I don't know medical terms, and somehow I have decided to have a brain blank on medical words. But I did hear you said something, carcinoma. Don't worry, we've got a doctor, we've got a specialist in the house. So we've got Antimoji, who is Mrs. Anima Shaun, and she's specialist in this one. So maybe she will help us to educate the public on what you are trying to say, and he will continue. So, Antimoji, because that's what I'm going to call you for the entire program. As you have said, I nicknamed you that name, and so I'm going to proudly be the one that tells everybody, Antimoji, go and speak to her. All right, let's go. What is a radiation therapist, and why is a radiotherapist important in treating cancer?
A radiation therapist is the technician who treats the patient. You have an oncologist who is the medical doctor who specialized in treatment of cancers, and that's the specialist who looks after the patient, is in charge of the patient management. But the radiation therapist is actually the person who does the treatment after it has been planned, the radiotherapy after it has been planned. A radiation therapist, it's in Nigeria, for instance, it's a bachelor's program. You have to do a lot of physics, a lot of math, a lot of anatomy, pathology, physiology. I'm saying this because a lot of people don't realize that. They just think that we set you up, come out of the room and press the button. But for us to be able to press that button, because it is millions of volts being put in the patient, you have to know exactly what you're doing. So it's a highly specialized area and profession in the cancer space. So that's what a radiation therapist does. So the doctor prescribes, the medical physicist or dosimetrist do the treatment planning, how the patient is going to be treated, and the radiation therapist treats the patient. So that's the team in a radiotherapy department. I think that should is clear enough.
I think that is. It's very interesting because, like you're talking about the radiotherapist, a lot of people have different experiences. Because if I think about Joy, who's sitting next on this program with us, if you look at Joy now and think about the process of her treatment as a salivary gland, then I think of my treatment using the gamma knife. Yeah. Can you explain both of them? So I think the first one you've explained will be the generic. No, can you explain both of them? Let me
see. Okay. The radiation therapy, like Joy had said earlier, is focused exactly on the area that you want to treat. unlike the chemo, which treats all the whole parts of the body. Anywhere there's blood, the chemo will get to. But with radiation therapy, it's specific high dose radiation, ionizing radiation to the area. And the importance of radiation therapy is because it's meant to quickly kill the cells, so they don't have a chance of survival, number one, and then they don't have a chance to go to other parts of the body, which is what will happen if it's not treated. So again, Joy had mentioned that they said that it's a fast-growing tumor. Some tumors are slow, like prostate. Some are fast, like salivary gland, like she talked about. So the important thing is to quickly treat them. For Joy, for instance, she probably would have had to have a mask, something to hold her head down, to keep it steady while she's having the treatment. It'll be specific to the area. And because of the area that they're treating, you have to treat the cancer cells, but then you don't want to damage the normal cells, because to get to the cancer cells, you have to have some effect on the normal cells, which is why there are side effects.
Thank you, ladies, for your contribution, for the guidance and the information you're giving with us. And we look forward to continuing in a few minutes once after this break. Thank you. Stay tuned. Welcome back, everyone, as I'm continuing this conversation with Mrs. Anima Shaun and Joy Ibude. I think we're having a fantastic conversation, and I hope you're able to pick out questions and thoughts about the experiences of cancer patients as they go through radiotherapy. Even though I've had it, I didn't really realize this is how it was. And listening to Joy, she had a very different experience. So it's just to let you know, our experiences are always going to be different, but the bottom line is we should strive to be able to get through it. So I'm going to go to the next question now. Ms. Anima Shaun, based on the conversations that Joy and I, or the experiences Joy and I have explained, would you say that what would you say are the key takeaway points that you want our viewers to make sure they understand? Because a lot of people do not take cancer treatment because they're afraid of, like what Joy has explained or what I've explained. But the truth is that both of us are still sitting here. Joy is sitting here since 2011. Is that when you said, Joy, right?
Yeah, that's when I had my radio.
Yeah. And mine is 2016. So really, we're still here, and that should be able to get through to people why they shouldn't run away from it.
Yes, and I totally agree with you. Your last point, that you are still here. As human beings, we should be able to put in our best. Whether we're here or not is not really up to us. Our responsibility is to look after our body. And if one gets cancer, radiotherapy is one of the basic treatments most of the time, unless it's a radio-resistant tumor that doesn't respond to radiotherapy. But radiotherapy, surgery, and chemotherapy are the three, and none of them is without pain. None of them is without discomfort. But at the end of the day, the result is what we're seeing with both of you being here. So the important thing is to work with the patients. I feel that a lot of counseling needs to go into treatment. And I'm glad that Joy said that lots of things were explained to her before she actually started the treatment. So when she got to that point, she could understand the reason why she had the pain in her throat, why she had the swallowing, and that you would cross that bridge and come out the other end with nothing. If you look at Joy's neck now, you would never know that she's gone through radiotherapy. I mean, you look at, you probably had your hair cut, and then Dr. Denise, but nobody would know that now. It's only a period of time. It's even something as simple as malaria. When you have malaria, you feel uncomfortable, but when you start taking the pills, you actually feel worse at some point first before you start feeling better. It's only that period for cancer treatment for the radiotherapy lasts longer than it would for malaria. But any drugs has some kind of effect on people. So there would be a time when things look as if you feel worse and then you start feeling better. So people have to understand that it is important when they say go for radiotherapy. Joy is sitting here today because they said you have to go for radiotherapy quickly because the cancer grows very quickly, and she listened. If you sometimes the taboo, and that's the sad part for me, the taboo for patients, maybe somebody who couldn't afford the treatment, but they don't want to go out and tell people, oh, please help me because I need to have treatment. I need to have radiotherapy. They feel that it's something they did wrong that causes cancer. It's not. So you have to be quick about getting your treatment. It's absolutely important. The diagnosis needs to be quick. The treatment needs to be fast, because every day those cells are growing. They grow in the organ, and then when the organ doesn't contain them, they start going to the lymph nodes, to the blood cells, to different organs. So it's very important that you have that radiotherapy to arrest it, if that's the first thing that they ask you to do, or if it's chemotherapy, whatever treatment, mode of treatment. But today we're talking about radiotherapy in particular, but you have to, it arrests the cancer, it stops the cells from growing, and you want to do that as quickly as possible. So it's very important for people to remember that the doctor who's asking you to do this, they know what they are talking about, especially if you go to an oncologist. And that's also another important thing, that you have to, when you come, you can pray as hard as you can, Muslim, Christian, traditional way, pray, use the doctor, but also make sure that you go to a specialist. Don't treat cancer through a general practitioner. Don't treat cancer through somebody who is not an oncologist. It doesn't give you the best fighting chance, because they are the ones who are trained to be in charge of oncology patients, just as well as don't get treated in radiotherapy without a radiation therapist. We have to educate ourselves so we can ask the right questions. When people in other parts of the world that is not Nigeria, they will ask you, are you a licensed, they don't even have to ask, because your license is meant to be there. Are you a licensed radiation therapist? Are you a practicing, do you have a current license? Are you an oncologist? They will ask these questions. It's your right to ask these questions, so that at the end of the day, you give yourself a fighting chance. And once we do that, that is really our own responsibility, to give ourselves a fighting chance when one has a cancer diagnosis. So radiotherapy is an important part of it.
Thank you, Mrs. Animashan, because I think that's one thing that's a very key message that people need to understand if we're going to make a difference going forward. And one thing I was going to talk about, which I think Joy has nicely covered, was most people think is very painful. Yes, it is very painful. We're not going to lie about it. Joy, I think we're going to agree on this. But it's not painful. It's okay. For me, it was painful at the time of doing it. So for that 6-hour period. But by the end of 48 hours, I was back on my walking around as if nothing had happened. And like Joy said, she went for 10 days. And before she realized that there was something going on, and managed for the rest of the treatment only to go back and start to heal. So we do heal from radiotherapy, which is what I'm trying to get to the general public. Now I'm going to ask everybody, all of us are going to answer this question, because as I round up, this is the key takeaways. What would you say, Joy, to the government if you were sitting in front of our new president today and he asked you what do you want him to do for you as a cancer patient? What would you say to him?
What I would say to our president, if I'm given the chance to speak to him, is to kind of set a scheme to assist our patients, cancer patients out there. Those that have been diagnosed of it, majority of them don't have the money to cope with the treatment. The treatment is expensive. The food aspect area is also expensive, because we kind of change our lifestyle. as a cancer patient. We can't eat everything anymore. So we are kind of selective, majorly eating balanced diet every day, and it's not easy. So if there's a way the government can assist both the ones going through the treatment and those that have gone over the treatment, at the time they assist them financially to meet up with any liabilities they are facing, then I would really appreciate that.
Thank you very much. So you see, yours is very straight and easy. You see, so one of the key things that has been found globally is that cancer is a very expensive treatment, and it affects every single person across the world. So anywhere in the world that anybody has cancer funding is actually a cause for concern, and it's something that is being raised globally for all of us, because I think all of us are going through it. Now, I would say for my own, it would be mental health and our psychosocial needs. Why would I come from that point? Because a lot of people do not realize that as a cancer patient, we go through mental health challenges only because we don't know what tomorrow holds. And a lot of us may either have family or people that are dependent on us, and we can't even fund ourselves, fund our treatment to even start to think. And that is why a lot of people fall off the bus, because of the funding. Mrs. Animashaun, can you give us your singular thing that you want? I mean, if you were speaking to His Excellency today, can you give him a message for us?
Yes. If I was speaking with Mr. President today, what I would say to him is that the NGOs should be empowered. The mental counseling that you talked about, the financial support, these are all things that can be taken up by the NGOs and get it to the people, to the point of contact, in terms of maintenance, in terms of addressing it to the right place at the right time. I think NGOs should be, especially in cancer care, because of the cost and all the things involved in it, NGOs should be empowered to the degree that they are more like a support system for the government in building all these fancy hospitals. NGOs should be empowered to ensure that the people who need the treatment are able to get the treatment. That's what I would say to him.
I want to say a very, very big thank you to you ladies for joining me today and working through, or rather discussing this radiotherapy aspect of the cancer journey, because a lot of the time words that are said are based on not knowledge, but what people say they think we're going through, or how they think we should be living this experience. So I want to thank you both very much for joining me this morning, wherever you are. Thank you. I really appreciate you. And to all our viewers, thank you for joining me and listening and participating. And we're hoping that you will help us spread the message. Whatever sickness it is, Mrs. Animashaun said, she said very clearly, she said, seek the right person to speak to. Seek the right person. There is your doctor, there is your oncologist, there is your radiologist. There are, all of them are there. There is the psycho people. There is that's why I call them. Please don't be upset, they're medical people. But all medical words are very, very big grammar. So I want to thank you all for joining me this today. Together we fight, together we win. You can follow Common Cancer Foundation on our social media handles. Subscribe, share, and this videos will be on our Common Cancer Foundation YouTube channel for you to watch. Mrs. Animashaun is also an NGO owner, and I would like you to say the name of your NGO, please.
St. Cyril Cancer Treatment Foundation.
Thank you very much. So if you are around that area, you need help, you need advice, you want to donate, or you want to support that charity, please reach out to them and meet and see what you can do. I want to thank you all for watching us. I want to thank Plus TV especially for giving us this space and for your continued support in creating cancer awareness and our cancer awareness program. We believe together we fight, together we win. We'll see you soon, and have a lovely Cancer Survivors Month. All survivors, let's all enjoy. At least we're getting through this month, and let's celebrate each other. Ladies, thank you for joining me, and thank you all. Have a lovely.